VA disability hack this and VA
Yeah,
disability
yeah.
hack that.
Yeah, yeah.
The only real hack is if you have private insurance. So for me, we have private insurance. I have VA healthcare. It's January, right? It's a new year. If I go to VA healthcare and get my prescriptions filled, that takes away from my deductible on private insurance because you have to inform the VA of your private insurance. So
Right.
the VA will take care of that. And so now that $3,000 deductible per year, every time I go to VA healthcare, it gets lower and lower. So that's just another way to save $3,000, right?
Right.
Okay.
Right.
Okay.
Yeah. Good
Back to
call.
what ChampVA covered.
Yeah. Yeah. So, and this is a question that I get all the time because people think for whatever reason that it's a very minuscule amount of coverage, right? So the things that it will cover, and it says covered services include, and this is directly from the VA. This is from the horse's mouth. And oh, by the way, the application is very easy to fill out. Although I screwed it up twice. It's a small form. It's very easy, and it's filled out by the, or at least it's signed by the beneficiary of it, which is not the veteran. It's going to be the spouse. So moving on through the covered services, ambulance services, ambulatory surgery, durable medical equipment, family planning and maternity, hospice, inpatient services, mental health services, outpatient services, pharmacy, skilled nursing care, transplants. So it sounds like everything I would want. I mean, actually, I don't want any of that, but you get what I'm saying, right? Sounds like everything you want for the just in case factor. So what's the bottom line here? The bottom line is that you have a few different avenues in which you or your family can be covered with ChampVA. One is you as a live veteran who's 100% permanent and total, your family can be covered with ChampVA. If you happen to pass away and you are 100% permanent and total, or you passed away from a service-connected condition, your family, spouse dependent, can still be covered with ChampVA, thus saving money and stress, really, because money can become a stressful factor. So is there anything that we're missing on this at this point, Clay?
No, just to kind of recap ChampVA, I would say, what is your situation like? And you're really going to have to sit down and plan it out. I do like how you have ChampVA and I'm using private insurance. So the viewers get both, aspects
Right.
of, hey, is this for me? And no one can really answer that for you. A very common misconception is the whole outline of VA healthcare and ChampVA. VA healthcare is for veterans. There are very, very rare instances that a family member can be seen by VA healthcare, and that is so rare that it's probably not going to apply to the majority of everyone watching. But ChampVA is health insurance for your family. The easiest way I like to describe ChampVA is it's comparable to TRICARE, right? You have your deductibles. It's very comparable. You have different levels of ChampVA, and that also, ChampVA does not include dental or vision, but you can have those added on, like something called the VA Dental Insurance Program, which is basically a prorated private insurance dental program for those that have ChampVA. So tons of benefits can be used for veterans that do meet the requirements for ChampVA.
That's very true. And here's one of the interesting things. If you're married to a veteran, so it's two veterans married to each other, and you both meet the qualifiers, you can actually be on ChampVA as well as a veteran, which is also interesting. Some of the eligibility requirements, right? This is often a question that we'll get. Mm-hmm. So yes, absolutely, ChampVA is essentially a health insurance. I like to talk about it as, for a lot of people, it's a supplementary or supplementary, or however you want to say it, tomato, it'll come as a second to a primary insurance if you have another type of health insurance. So if you already have through your employer or something like that, a health insurance for your family, that becomes a secondary and it'll pick up, any kind of out-of-pocket costs, that type of stuff, potentially. Now, if you do not have any other insurance covering your family, your spouse, your dependents, That's where this really comes into play. Like you were indicating, this becomes a primary insurance. You must inform ChampVA, and their phone number is pretty easy, and you can call them and they answer fairly quickly. You need to inform them if you're switching from, hey, this is a secondary because I already have a primary insurance through my employer or what have you, to now I don't, and now I need you to be the primary. You need to inform ChampVA that they need to be the primary and you have no other insurance. That's an important piece. So as far as being able to qualify or be eligible for this program, I'm just going to read it off of the site. I know you love when I read, Clay, especially with how good I do it. But whatever, we'll stumble through it here together. So am I eligible for health care from ChampVA? So first of all, ChampVA, well, I was going to give you the name of it. It's Civilian Health and Medical Program of the Department of Veterans Affairs. As fun as that is to say. So that's why nobody ever calls it that, because it's a mouthful. So it's just ChampVA, but that's what it really means. So one of these must be true. You're the spouse or child of a veteran who's been rated permanently and totally disabled for service-connected disability by a VA regional office. So in other words, right, total and permanent, or permanent and total, those two things, can you explain that, Clay, for our listeners, viewers, so they know exactly what the VA means when they're saying rated permanently and totally?
All right, so there's two different P&T ratings. There's IU P&T, sometimes it's called TDIU P&T, and then there's 100% scheduler P&T. Both get the same benefits, okay? P&T is P&T regardless of how you get there. Versus IU, not P&T, or 100% not P&T. There still are 100% benefits, but not at the P&T mark. So at that P&T mark, permanent and total, you are eligible for ChampVA. So what does that actually mean? Okay. Being permanent and total means that your static disabilities, static means they're not likely to improve over the span of the veteran's life. Your static disabilities reach 100%. So you could be 92% static and 100% schedular because you have acne at 30% pushing you to 100. But we know that creams cure acne, right? So that would be an example of being 100%, but not P&T.
Got it. So to encapsulate that a little bit, anytime you hear permanent and total from the VA, permanent means that it's not likely to change, right? That static piece that Clay's talking about. And total means 100%. So those words are interchangeable. Total means 100%, and permanent means that it's not likely to ever get any better. And so the VA has just conceded to your conditions being what they are. The next qualifier here is if you are the surviving spouse or child, because ChampVA is for both or all, right? So whether it's your spouse or your children. So you're the surviving spouse or child of a veteran who died from a VA-rated service-connected disability. Now, this one's important because a lot of people will, just like VA benefits, we tend to self-segregate out of qualifying, and I hate that. What happens here is your death certificate has two spots on it. It has cause of death and it has contributing cause to death. Oftentimes, the contributing piece is empty, but it's there, and you can have amendments to your death certificate if needed. So an example would be if the veteran died from a heart attack, right? Heart attack, died of a heart attack. And it says on the death certificate, died of a heart attack. But they weren't service-connected for any heart conditions. Well, they didn't die from a service-connected condition. However, that veteran had hypertension. Mm-hmm. You could go back and have that death certificate amended and have them add hypertension as a contributing cause to death. That would then qualify for this purpose as cause of death. Okay, the VA views both as the same, contributing and cause as the same on the death certificate. So that's an important piece that we need to remember and utilize. I've had to help people with that in the past, and it worked out fine. So that's the next one. The next one here is you're the surviving spouse or child of a veteran who was at the time of their death rated permanently and totally disabled from a service-connected disability. Huh. All right. So again, we're hearing the permanent and total, so 100%. So what's the difference between these last two that we just talked about? The one prior is you could be rated at, all you have is a 10% rating for hypertension. And that's your only rating. And you die of a heart attack, you could have the hypertension listed on the death certificate to qualify you for ChampVA. The next one is you're 100% rated, permanent and total, permanent not changing, 100%, and you die, doesn't matter, right? If you died as a 100% rated veteran who's permanent and total, then your surviving spouse and children can also obtain this benefit. The last one, sorry, I'm going on, Clay. You're the surviving spouse or child of a service member who died in the line of duty, not due to misconduct. However, in most cases, this is going to qualify you for TRICARE. And so most of the time, you're not going to be on the ChampVA kind of aspect. Now, I want to kick it back to you, Clay, with a couple questions on this that I've heard anyway. How does an individual utilize, and I know you touched on it, so you just got to dive a little deeper, I think, for me on just to kind of walk somebody through it. You know, fine, I have ChampVA, but now what? You know, is there a ChampVA doctor somewhere? I mean, how do I figure this out? And also, what kind of things would this cover?
All right, so ChampVA is comparable to TRICARE or any other private insurance. Obviously, there are better ones, and there are some that aren't as good as ChampVA. And so the best way to look at ChampVA is it's health insurance. There are in-network providers and then in-network hospitals. And then you'll have something to note. If a doctor is out of network, but they contract with that facility, and that facility is in network, you can still receive care from that provider given it's in the network. So I'll give you a quick example, right? My daughter has tons of appointments at Richmond, down in Richmond, Virginia, tons of appointments. Her doctor is out of network, but Richmond VCU is in network. So that is something that would be covered under ChampVA. And so everyone's situation is different, and something that I'd really want to push for ChampVA or private, whatever your situation is, there is no cookie cutter answer. You really have to sit down and say, hey, is ChampVA right for me? Now, one thing I do want to add as a planning factor, and I think this really trips up a lot of veterans at the P&T mark, is when you apply for ChampVA, we're talking the Department of Veterans Affairs, okay? It is about a 6 month, I've heard up to 9, but I think 6 or 7 would be average to apply for ChampVA and then be approved for ChampVA. And that's a large amount of time for anything that happened, especially if your family already has any sort of health conditions, whether that's genetic or a car accident happens. That is a large amount of time. So planning is a huge factor in ChampVA. And I like the supplemental mindset. That might be something that I might consider myself. You know, I personally don't use ChampVA. So in my situation, we have private insurance through my wife's company because her company's insurance is really, really good. And not to get too personal, my kids have a lot of stuff going on. And so we use private insurance. For me, I'm not comfortable with ChampVA. Now that's me. Your situation, to the viewers, you have to make that decision for yourself. There's really no cookie cutter type answer for that.
Yeah. And that's a good point. And for some people, it might be the only real option.
Yeah, absolutely.
You know what I mean? So I'll tell you that if you haven't priced out paying for insurance privately, it sucks. It's expensive. So this goes to the part about putting money back in your pocket. So let's say that you don't have an employer. or even if you do,
Hmm. Hmm.
in some cases, paying for your whole family to be covered can take a lot of money out of your check. Or if you're not working and you're paying for insurance just privately, it could cost thousands of dollars a year. So this is a way that you can deal with that. In addition, you can also have the opportunity to be able to utilize ChampVA for your prescriptions. Now, for me personally, we just switched it over to becoming the primary insurance for my spouse and my dependent. Okay, and it's so far it's worked out fine. We've utilized the pharmacy. We called the pharmacy. Hey, do you take ChampVA? They're like, yes. And we're not near a military base anymore. Before it was like I could hit a golf ball to the closest military base. So there it was like, okay, everybody knows what this stuff is. Everybody knows what TRICARE is. Everybody knows what
Hmm.
ChampVA is because of the community. But now we're in a situation to where, we're not around that, and they still do understand because there's enough, I guess, veterans here that they get it. Some of the things that it covers, I want to jump into that. I do have a list pulled up, so I'm kind of cheating, but it does help to just run through them for those that are aware. Is there anything off the top of your mind, or you want me to just run through the list?
Not on what it covers, but there is an underlining cheat code, so to speak. This is the
Yeah.
only, you'll talk about people